ICD-10-CM Practice Questions Medical Coding Test Prep and Review 35 Difficult Questions. Question 1. What does the X in an ICD-10-CM code often serve as? A placeholder for future expansion, an indicator of an error, the end of a code, a link to another code. The X is used as a placeholder to allow for code expansion while maintaining the required character structure. Question 2. Which of the following codes represents essential, primary, hypertension? I-10, I-15.0, I-11.9, I-12.0. I-10 is the specific code for essential hypertension. Question 3. In ICD-10-CM, a Z code is used for acute injuries, factors influencing health status and contact with health services, mental health disorders, diseases of the circulatory system. Z codes cover reasons for encounters other than illness or injury, example vaccinations, screenings. Question 4. When a patient has both type 2 diabetes and chronic kidney disease, which code should be sequenced first? The diabetes code, the CKD code, it doesn't matter, a V code. ICD-10 guidelines generally sequence the underlying condition, diabetes, first, followed by the complication, CKD. Question 5. The seventh character in an injury code usually signifies an initial encounter, a subsequent encounter, a sequela, an accidental injury. Character represents the initial encounter for active treatment. Question 6. What is the default type for diabetes mellitus if not specified in the documentation? Type 1, Type 2, Secondary, Gestational. According to ICD-10-CM guidelines, Type 2 is the default. Question 7. Which of the following is an example of an external cause code? V00Y99, A00B99, C00D49, M00M99. Chapter 20, V00Y99, contains codes for external causes of morbidity and mortality. Question 8. In the code E11.9, what does the .9 indicate? With complications, without complications, with ketoacidosis, with neuropathy. E11.9 is type 2 diabetes mellitus without complications. Question 9. Which instruction in the tabular list indicates that two codes are needed? Excludes 1. Excludes 2. Code also. See also. Code also prompts the coder to report an additional code if applicable. Question 10. Excludes 1 means the conditions can occur together. Not coded here, the two conditions cannot occur together. You must use two codes. The code is invalid. Excludes 1 is a pure excludes note, indicating that the code excluded should never be used with the current code. Question 11. What does NOS stand for in medical coding? Not otherwise specified, not on site, new onset symptom, normal on schedule. NOS is the equivalent of unspecified. Question 12. The index to diseases and injuries is organized numerically, alphabetically by main term, by body system, by severity. Coders start with the alphabetic index. Question 13. Which code would be used for a patient with a family history of colon cancer? C18.9, Z85.038, Z80.0, K52.9. Z80.0 is the code for family history of malignant neoplasm of digestive organs. Question 14. Sequencing acute respiratory failure as a secondary diagnosis occurs when it is the reason for admission. It develops after admission. It is caused by the primary condition. It is never a secondary diagnosis. If it develops after admission, it is sequenced after the principal diagnosis. Question 15. A sequela, seventh character S, refers to the initial injury, late effects of an injury or illness that has resolved, the recovery phase, a planned surgery. Sequela codes are used for complications or conditions that arise as a direct result of a previous condition. Question 16. Which of the following is used to code a screening for breast cancer? C 50.911, Z 12.31, Z 80.3, and 63.0. Z 12.31 is encounter for screening mammogram for malignant neoplasm of breast. Question 17. Where can you find the official ICD-10-CM guidelines? In the back of a dictionary, at the beginning of the codebook, in the hospital employee lounge, on a patient's chart. Official guidelines are published annually and included in the coding manual. Question 18. Which character in an ICD-10-CM code identifies the chapter/category? The first character, the third character, the last character, the period. The first character is always a letter and indicates the category/chapter. Question 19. A late effect of a stroke, example hemiplegia, is coded using Chapter 1 codes, Category I-69 codes, Chapter 20 codes, the Z-code index. Category I-69 is for sequelae of cerebrovascular disease. Question 20. When coding for MRSA colonization, which code type is used? A code for infection, a Z code, Z22.322, an S code, a B code. Carrier or colonization status is coded with a Z code.